Hello people, in this video we will look at anti-gout drugs. So what is gout? Do you know what gout is? First of all, you have to understand what gout is. See, gout is a metabolic disorder characterized by hyperuricemia. Hyperuricemia. That means more amount of uric acid or the urate levels in the plasma will be more. Or to explain in better terms, the uric acid in the blood will be more. Okay, hyperuricemia. Emia is blood, right? So, this is increased plasma urate concentration. Now, they will ask, increased means how much? See, normal plasma urate levels are, normal levels are 2 to 6 milligram per deciliter. Okay, now? So, above this somewhere, you can call it as hyperuricemia. Above this probably. Okay. Now, what is this uric acid? From where this uric acid came? See, uric acid comes when there is purine metabolism, right? It is a product of purine metabolism. Purine metabolism. Now, if you are asking what purines are, purines are all those, nucleotides, right? A, T, G, C. You have seen in DNA. In that, which are all are purines say? What is D? Adenosine, thymine, cytosine, guanine. A and G, right? These two are purines. So basically when these purines are metabolized, right, they are broken down. When purine is broken down, like adenosine and other things are broken down, you will get this. Purine is broken down. Guys, just pay attention here. We will write here. Purine is broken down. You will get hypoxanthine and guanine. So let's say you get xanthine. Then from xanthine you get uric acid. Okay. So this is how it goes. So you should know the metabolism. Then only you will be able to explain the drugs, correct? So basic this much you understand. Purine is breaking down xanthine, uric acid. Okay. So when there is excess purine breakdown, what will happen? Lot of uric acid will be there. So this xanthine is being converted into uric acid by one enzyme called as xanthine oxidase. Better you look at this diagram only. See here, purine. Where is it? Purine are broken down into xanthine. Xanthine with xanthine oxidase becomes uric acid. See here. Again we will explain. Xanthine oxidase becomes uric acid. From where you got the xanthine? From the metabolism of purines. This much you understood. No, basic you should understand of this much. Purines, that is adenosine and guanosine. You decompose or break them down, you will get hypoxanthine guanine, that is xanthine. With xanthine oxidase, it becomes uric acid. Okay, take a look at this. Now we'll move on. So, we were looking at what gout is. Still we were there only, guys. Hold on. We were looking at what gout is. So this uric acid, actually it has to go into urine. Correct? It is excreted in urine. It has low water solubility. Okay. At low pH. So what else should we know? Hold on. Basically, guys, this uric acid, right, if it becomes more, it precipitates and deposits in joints, kidney, subcutaneous tissue, etc. It precipitates and deposits in joints, kidney and subcutaneous tissue. This is called as tophi. Okay, we'll give a diagram. Wait. You see this inflammation here at the joint. This one. This you can see the phalange or whatever this, right? These two bones you can see here in between. There is deposition and there is gout. Gouty arthritis this becomes actually. Now this is kind of a primary gout, okay. Now in secondary hyperuricemia what happens? Some other disease will cause increased hyperuricemia like leukemias, etc. Now some drugs also increase uric acid, you know. Wait, we will say this. This is primary. Secondary causes for hyperuricemia will be like leukemia, drugs like we have seen a few recently, right? Thiazide, they are saying furosemide So many are there. We will come to all this, okay? So some drugs also increase the uric acid levels in our body. So basically, what is the treatment, guys? The treatment, wake up if you're sleeping. See, we're looking at the treatment of gout, right? So basically, in the treatment of gout, there's classification given here. Very simply, they gave off, if it is acute gout, give this. If it is chronic gout, give these, okay? So if it is acute gout, what will you give? If it is acute gout, give that person NSAID, colchicine and steroids, okay? If it is chronic gout, give that person, probenecid, allopurinol, okay? These are the drugs. Especially in all these, the main thing you should know is allopurinol. This will be the main one, allopurinol, okay? Exam wise, what and all are important? You know, this uric drugs like probenecid. So uric drugs, their action, the names, probenecid, this is important, okay? Otherwise, what is important in this, colchicine also important. Colchicine, mechanism of action, use, adverse drug reactions, this is also important. So what and all will we focus on? We will focus on colchicine, uric drugs, probenecid and allopurinol. Allopurinol also is important, okay? Allopurinol is actually the drug that you have to use, okay, for gout. So acute means you know that it is sudden in onset. Suddenly there is severe inflammation in the small joint due to precipitation of these urate crystals in the joint space. The joint will become red, swollen. The joint itself will become red and swollen and extremely it will be painful, right? So you will give treatment with strong anti-inflammatory drugs like NSAIDs, right? First you will give off this treatment. Don't try to reduce the urate level. First, anti-inflammatory is very important, okay? Once the attack subsides, then you will start giving urate lowering therapy. This is kind of different, right? So this is something very unique. In acute, what they are saying, let's make a new slide here. Acute gouty arthritis. Arthritis means now it has reached the joints, right? So here, first give NSAIDs, anti-inflammatory drugs you should give. Then, after this attack subsides, then you should give, after attack subsides, then give urate lowering therapy. Wake up guys if you're sleeping. We are discussing anti-gout drugs. There, what we said, first you should give off anti-inflammatory drugs. Then you should look at reducing urate levels, okay? Don't give off first only urate level reducing. First inflammation only you have to control, it seems. Now, NSAIDs, which and all you should give? Just if you write off NSAIDs, it's not enough, no. You should give indomethacin, diclofenac, then pyroxicam, then you should give naproxen, so many drugs, and even uricoxib. But I thought these xibs are not used. Whatever they say in textbook, we will type what for us? Uricoxib. So they are given in relatively high and quickly repeated doses. They will be quite effective in terminating the attack, but it may take 1 day to do all this, half day to 1 day. Complete resolution takes place in 5 to 10 days. Okay. Colchicine also you can give, but that is not NSAID. Okay, but these are tolerated better. NSAIDs are tolerated better by the people. Okay. What else then? So basically these are anti-inflammatory drugs, remember. How they work and all, you know, no COX inhibition. All that, no COX inhibitor. All that you know how they work. This naproxen and this pyroxicam, they inhibit chemotaxis also, okay. They inhibit chemotaxis of leukocytes into the inflamed joint. That is the neutrophils, right? That's all guys. Let's move on. We are done with NSAIDs. Then let us look at colchicine. Colchicine for exam you should know. So colchicine. So acute gouty arthritis, we finished NSAIDs. Now we are going to colchicine. What is colchicine? So colchicine is from the, it's an alkaloid, okay. It is from this Colchicum autumnale, okay, and it has been used for gout from 1763. Wow. It is a pure alkaloid, right? Obviously it's an alkaloid. It is actually, it suppresses gouty inflammation. Obviously we are looking at only here anti-inflammatory drugs, right? Anti-inflammatory. Go back to the classification. Oh, this is also, colchicine is also anti-inflammatory, or does it have any other action? Actually, they are saying here that colchicine is not anti-inflammatory. It suppresses only gouty inflammation. Suppresses only and only gouty inflammation. Interesting, na? And it does nothing to the uric acid levels. It suppresses only the inflammation, and that too only gouty inflammation, okay? So it doesn't do anything to the uric acid level. So one thing you should know here, let's say this is the joint or something. We'll just try to draw something now. See, let us say this is the joint, okay? This is one bone and here one bone. This is some joint you had here. This is the joint. Here all these urate crystals will come and stay here. So they will be engulfed, right, by the synovial cells, will engulf this uric acid. Now what will happen? A lot of inflammatory response will start, and a lot of inflammatory cells starts coming here. This joint becomes totally inflamed. Right? So now you are giving colchicine, which is going to suppress this inflammation. Okay. In this, wherever you had that gouty uric acid crystals, right? In that, in those synovial cells, those will be eaten up by the phagocytes. The phagocytes will pick up these urate crystals. Okay. Then they release glycoprotein, which aggravates the inflammation. So now let us just see what colchicine does. Our job is only to see what colchicine does, right? Colchicine, it, you know what it does? It inhibits the release of chemotactic factors. The chemotactic factors are inhibited. So what happens? The subsequent events, you know, all these cells coming, the inflammatory cells coming, the granulocytes coming, all that will be stopped. So by binding to what? How does it suppress gouty inflammation? It binds to fibrillar protein, okay, that is tubulin, right, and it inhibits granulocyte migration, that is the neutrophil migration, everything to this joint it will stop, so that there is no inflammation. Now if this granulocyte comes, what it will do? It will eat that urate crystal and it will release glycoprotein, it will aggravate inflammation. There is lactic acid production, pH becomes less, it becomes acidic, the urate crystals become precipitated, lysosomal enzymes which are released cause joint destruction. So all that will stop because granulocytes only won't reach there. So only this specific gouty inflammation, this colchicine is able to control. Okay. This is also antimitotic. It causes metaphase arrest. Okay, it is antimitotic. Okay, it's antimitotic. It causes metaphase arrest by binding to microtubules of mitotic spindles. Okay, causes metaphase arrest. So in metaphase, you know, everything will be in the middle. So that microtubules of this mitotic spindle, everything it will bind to, and this colchicine will bind and will arrest it there only. Then increases gut motility through neural mechanism. So gut motility increases. So you might have some diarrhea maybe. Increases gut motility, right? Through neural mechanisms. Colchicine is rapidly absorbed orally. So let us see how this colchicine is given. So obviously this colchicine are actually given like this tablets. Okay, they are given orally. So they are partly metabolized in the liver, they are excreted in bile. Wow, another drug which is excreted in bile, just like rifampicin, what and all. We saw so many drugs, right? So this colchicine, we will take up in the next slide better. What you see? Colchicine. So this colchicine, where are we? Here. Now this colchicine Acute Gouty Arthritis continued. So colchicine, what it does, it is given orally. It is partially metabolized in liver and excreted in bile. Okay, partly metabolized in liver and it is excreted in bile. Important point, okay. It is excreted in bile. Which one? Colchicine. Colchicine is excreted in bile, just like rifampicin, etc. Now, it undergoes enterohepatic circulation. Ultimate disposal occurs in urine and feces over many days. Wow, it takes many days to leave our system. Okay. Some inhibitors of some enzyme retard colchicine metabolism and enhances toxicity. So, even colchicine toxicity can happen. Colchicine toxicity can happen because the other drugs may reduce its metabolism. Okay. Toxicity of colchicine is high and dose related. Nausea, vomiting, diarrhea. Obviously that and all you guessed now. As soon as we said increased gut motility and it is given orally, you can say nausea, vomiting, diarrhea or standard things you can say. Abdominal cramps, etc. can occur. Accumulation of the drug can happen in the intestine and because it inhibits mitosis, right? You have already seen here, it's anti-mitotic. So as it does all this, okay. So what happens, the turnover of the mucosa, okay, inhibition of mitosis, okay, in its rapid turnover mucosa, responsible for toxicity. So basically I am thinking that there will be rapid turnover mucosa in the intestine, but as this drug accumulates in the intestine, there will be inhibition of mitosis, so it is toxic, it will become toxic. So overdose of colchicine, guys, overdose of colchicine produces kidney damage, CNS depression, intestinal bleeding. Death is due to muscular paralysis and respiratory failure. What the hell? It can lead to death also. Huh? So what and all they are saying? Intestine is affected, kidney is affected, CNS depression, intestinal bleeding, respiratory failure, muscular paralysis and respiratory failure can lead to death. Wow. Respiratory failure can lead to death. So this is about colchicine toxicity. Who increases the colchicine toxicity? Some other drugs which inhibit some enzyme which metabolizes this colchicine. Okay. Colchicine is the fastest acting drug to control an acute attack of gout. So it's the fastest acting drug. Colchicine is the fastest acting drug. Now how many people are sleeping? So many people are sleeping, no? Fastest acting drug for what? To control acute attack of gout. To control acute attack of gout. Okay. Thank you so much for paying attention. How many people are sleeping? Do you want us to play a song for you or something so that you will wake up? We'll play you some nice music, wait, so that you wake up. It's a kid which tell you, wake up, okay? Thank you, wake up. So let's go back here. So we are done with colchicine, guys, but it is not the first choice. The first choice of anti-inflammatory for acute gouty arthritis is actually NSAID, okay? But it is used second to NSAID, not first. First is NSAID, okay? Let's move on then. So what and all we have seen now in the classification, acute gouty arthritis, we see finished NSAIDs, colchicine, now glucocorticoids, that is nothing but immunosuppressant. Acute gouty arthritis continued. In that we have to look at corticosteroids. So corticosteroids, what and all you will give? Some, they are giving some name which I never heard actually. Triamcinolone triamcinolone acetonide. Okay, it is injected, intra-articular injection is given. This is a soluble steroid. It is given intra-articular injection. That means into the joint it is given. Imagine how painful. Into the joint they'll give an injection of the steroid which suppresses the symptoms of gout. Again, this is only symptomatic relief only. All these are symptomatic reliefs only, right? So basically, when few joints are involved, okay, then they are not tolerating NSAID or colchicine, then only you should give this corticosteroid, okay. So first, only give if few joints are involved, only if few joints are involved they will give this, okay. And if they are not tolerating NSAID and colchicine, and if not tolerating NSAID or colchicine. What is colchicine? Basically, it is an inflammation control only in gouty inflammation. It is suppression of only gout inflammation. It is an anti-gout inflammatory drug. Now coming here, we are looking at corticosteroids. So the example here they gave was triamcinolone acetonide. Triamcinolone acetonide. Okay. Now, systemic steroids they don't give. This is a soluble steroid. They are giving it locally. Intra-articular injection means only into the joint, right? So obviously it's a local route of drug administration. It is not a systemic route of drug administration. Systemic steroids, they are not given that much, okay? So, I think we can move on. If you want, you can say prednisolone, etc. Systemic. Now, in the next video, we will look at chronic gouty arthritis and its treatment, guys. What do you say? In the next video, let us look at this chronic gouty arthritis, HyperUricemia for a long time. Chronic gouty arthritis, we will look at in the next video. The drugs that we will be looking at will be these. Probenecid. We look at probenecid that has uric action. Probenecid and allopurinol. Okay, this is a synthesis inhibitor. It stops the synthesis of uric acid. Right? So, allopurinol. We'll come back in the next video and look at these. Is that fine? Okay, say a bye and we'll meet you in the next video. Okay? Bye-bye.